COVID-19, Interim Guidance for Healthcare Facilities, a course offered by Healthcare Academy. During this lesson, we will discuss the topics listed at the left. Each topic has a related objective. At the right, you will see objectives and an outcome for this lesson. At the end of the lesson, a quiz will be offered. You will receive a certificate of participation if you successfully complete the lesson with a score of 85%. Let's take a moment to get acquainted with some of the navigation features within Healthcare Academy. All Healthcare Academy lessons have an online glossary of terms. If you see a term that is blue and bold, click on it. Learning links are red, bold, and underlined. If you have a question at any time in this lesson, click on the graphic in the lower left corner of the page and an email window will appear. A recent outbreak of respiratory disease caused by a novel or new coronavirus, first detected in China, has now been detected in 60 locations internationally, including the United States. The virus and the disease it causes has been named Coronavirus Disease 2019. It is now considered by the International Health Regulations Emergency Committee of the World Health Organization and the U.S. Department of Health and Human Services to be a public health emergency, both internationally and nationally. This course will explore what is currently known about this virus and the implications for long-term care facilities. Other names in association with this novel virus include those listed at the right. Current understanding about how the virus that causes COVID-19 spreads is largely based on what is known about similar coronaviruses. Coronaviruses are a large family of viruses that are common in people and many different species of animals. COVID-19 is a new disease and there is much to learn about how it spreads, the severity of illness it causes, and the extent it can spread in the United States. This is an emerging, rapidly changing situation. The Centers for Disease Control is providing updated information and guidance as it becomes available. This course serves as the sharing of interim guidance from the CDC. Click on the link at the right to view the situation summary with the latest CDC updates. Although rare, animal coronaviruses can infect people and then spread, such as with this new virus. Early on, many of the persons at the epicenter of the outbreak in Wuhan, Hubei Province, China, had some link to a large seafood and live animal market, suggesting animal-to-person spread. Later, information leaned towards person-to-person spread. Some people have been infected who are not sure how or where they became infected. Click on the image at the right to view the World Health Organization video.
In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors, such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets, created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider. That's a quick look at this emerging infectious disease. Given that this outbreak is evolving rapidly, what's known about this virus could change. Please check the websites below for the most up-to-date information.
Like other coronaviruses, it is thought to be spread or transmitted person to person, spread mainly by respiratory droplets produced when an infected person coughs. Click on each transmission mode at the right to learn more. Reported illnesses have ranged from mild symptoms to severe illness and death for confirmed COVID-19 cases. These symptoms may appear 2 to 14 days after exposure to the virus and include a fever, cough, and shortness of breath. The virus that causes COVID-19 seems to be spreading easily in some affected geographic areas, or community spread, which means people have been infected without clear indication of how or where they became infected. Another concern by many is whether someone spread the virus without being sick. People are thought to be most contagious when they are most symptomatic or the sickest. Some spread might be possible before people show symptoms. There have been reports of this occurring with this new coronavirus, but this is not thought to be the main way the virus spreads. Contact your healthcare provider if you develop symptoms, have been in close contact with someone known to have COVID-19, or have recently traveled from any area with community spread of COVID-19. Let's review what you have learned so far. Coronaviruses are a large family of viruses that are common in people, common in many species of animals, transmitted by insects, or transmitted by food. Incorrect. Please try again. Correct. While there are still many unknowns, it is thought that COVID-19 is spread by contact with infected surfaces or objects, animal to animal only, person to person, or person to animal. Click on all that apply. Incorrect. Please try again. Correct. There is currently no vaccine to prevent COVID-19. The best way to prevent illness is to avoid exposure. The CDC always recommends everyday preventive actions, including hand washing, staying home if you are sick, avoiding touching your eyes, nose, and mouth, avoiding close contact with people who are sick, covering your cough or sneeze with a tissue, then throwing the tissue in the trash, and cleaning and disinfecting frequently touched objects and surfaces using facility-designated cleaning spray or wipe. Visit that. Certain populations are at greater risk for not only acquiring the disease but having serious outcomes. In China, there is a 1% to 2% fatality rate with an 8% to 15% among older adults. Nursing homes have the double risk factors of susceptible individuals in group setting. A long-term care facility in the state of Washington recently became the first U.S. site of a coronavirus outbreak, confirming that this is a setting that requires heightened awareness, monitoring, and planning. Click on the image at the right to view CDC recommendations specific to long-term care facilities.
East Wing, you have a family member on Park 1. East Wing, family member, Park 1.
All long-term care facilities should be aware of any updates to local and state public health recommendations and regulations. Some states have specific requirements related to diseases spread by droplet. Click on the image at the right to view an example of transmissible disease standards.
Part 2, East Wing, Part 2, please. Wing, you have a call on Park 1 and 2. East Wing, family member on 1 and 2.
Because much is still unknown and evolving, the recommendations from CDC may not prevent all transmission or anticipate every potential scenario, and will change as more information becomes available. Long-term care facilities, in consultation with public health authorities, should use clinical judgment as well as the principles outlined in the CDC guidance to assign risk and determine need for work restrictions. All long-term care facilities should carefully review their infection control and prevention policies, procedures, and practices, as well as their emergency preparedness plan. Click on each to learn more. A communication plan is key for staff, residents, and families is key. Staying informed about the local COVID-19 situation is a must. Know where to turn for reliable, up-to-date information in your local community. Monitor the CDC COVID-19 website and state and local health departments for the latest information. To view the official CDC interim guidance on outbreak of COVID-19 from the CDC Health Alert Network, visit the website at the right. Facilities should have a system in place to communicate the plan and a facility status update to residents, families, staff, visitors, and volunteers. Click on each image at the right to view communication points. Resources available to help guide long-term care facilities in planning for and dealing with COVID-19 are listed at the right. Click on each to learn more. It is important that facilities provide comprehensive training for staff at orientation and annually. A training update should occur if there are facility changes that impact the exposure control plan that applies to COVID-19. This update must specifically address signs and symptoms, modes of transmission, how to prevent or reduce exposure, what to do if an exposure incident occurs, vaccinations, when they become available, decontamination and disinfection procedures, tasks and activities that may expose the employee to the virus, and proper use of personal protective equipment. Let's review what you have learned so far. Symptoms associated with COVID-19 include fever, weight loss, cough, or shortness, correct? General precautions to avoid the spread of COVID-19 include avoiding close contact with people who are sick, avoiding touching your eyes, nose, and mouth, staying home when sick, or disinfecting frequently touched objects and surfaces. Correct. Strategies to address COVID-19 in long-term care facilities include reviewing facility infection control plan, reviewing facility emergency preparedness plan, refusing new admissions until the threat of COVID-19 has passed, or developing a communication plan. Click on all that apply. Correct. Because of the risk of panic, long-term care facilities should not communicate the status of the facility as it relates to the COVID-19 with residents and their family members. True or false? Correct. As a staff member, you have the responsibility to know the facility infection control plan, signs and symptoms of COVID-19, what job activities may expose you to the virus, or what to do if exposed to the virus. Correct. Because COVID-19 is transmitted by droplet contact, staff must know location of PPE, the uses and limitations of PPE, proper removal of PPE, or proper disposal of PPE. Correct. Should the coronavirus be found in your facility, it is important to protect your employees and the residents. Not all residents with confirmed or suspected COVID-19 require hospital admission. Some persons with an initial mild clinical presentation may worsen in the second week of illness. Facilities must work in consultation with their medical director and public health department to evaluate on a case-by-case basis the need for testing staff or residents for COVID-19. The CDC has developed clinical criteria for COVID-19 based on available information about this novel virus and is intended to serve as guidance for evaluating and testing residents under investigation. Click on the image at the right to enlarge.
A family member on Park 1. 100 home nurse, you have a family member on Park 1.
The CDC has also provided interim guidance to assist facilities with assessment of risk, monitoring, and work restriction decisions for their staff with a potential exposure to COVID-19. Because of their extensive and close contact with at-risk individuals in the facility, a conservative approach to monitoring staff and providing restrictions from work has been implemented. Quick identification of early symptoms and prevention of transmission in a healthcare setting is necessary. Click on the image at the right to learn more.
Good afternoon, staff and residents. We will be holding bingo in the Anna Marie, the Siesta Dining Room this afternoon. Again, that is bingo at 2 o'clock in the Siesta Dining Room. Staff, if you can assist the residents down to their dining room, I greatly appreciate it. We look forward to seeing your smiles.
Quick identity. Each facility should conduct a facility-specific risk assessment for exposure to COVID-19. Based on the risk for exposure, each department and employee would be assigned to a category. It is important that employees know their risk classification based on their role and responsibilities at the facility. Click on each classification at the right to learn more. Visit the CDC website to access the interim guidelines for risk assessment by clicking on the image at the right. Testing may be considered for healthcare workers if there has been exposure to a person with suspected COVID-19 without laboratory confirmation. Due to their extensive and close contact with vulnerable patients in healthcare settings, even mild signs and symptoms, sore throat, of COVID-19 should be evaluated among potentially exposed healthcare personnel. CDC guidelines and parameters for staff monitoring are listed at the right. Click on each link to learn more. Long-term care facilities should put strategies in place to prevent the likelihood of an occurrence of COVID-19 and the prevention of its spread. Strategies should be based on a facility risk assessment and modified as new information becomes available from the CDC. Click on each link at the right to view guidelines and specific interventions for best strategies. To access the CDC Healthcare Facility Preparation Guide, visit the website at the right. Let's review what you have learned so far. The CDC clinical criteria for evaluating and testing residents for COVID-19 include fever, signs or symptoms of lower respiratory illness, and close contact with a person with laboratory-confirmed COVID-19 within 14 days of symptom onset. A history of travel from affected geographic areas within 14 days of symptom onset. Has health insurance that supports testing for COVID-19, or has at least 2 additional diseases that place them at risk. Click on all that apply. Correct. The CDC guidelines for testing staff are based on close contact with an infected person. Close contact under these guidelines include being within approximately 6 feet of a COVID-19 case for a prolonged period, having direct contact with infectious secretions of a COVID-19 case, having direct contact with a COVID-19 case while not wearing recommended PPE, or sharing a healthcare waiting area with a COVID-19 case. Click on all that apply. Correct. Proper adherence to currently recommended infection control practices, including all recommended personal protective equipment, should protect staff having prolonged close contact with residents infected with COVID-19. Health